Hello, everybody. Mary Marshall here, registered nurse, diet and lifestyle educator, and healthcare concierge. So, coming at you with today's Friday 411. And today we're talking about doing the third installment and about pain. And today I'm going to talk about, well, what to do about it if you have chronic, especially musculoskeletal pain. And I do want to thank Eileen Kopsoftis of Have Lifelong Wellbeing. She is our manual PT extraordinaire, and she is the source of much of this information that I'm sharing with you today. So, and if you have issues with pain, she definitely is someone to connect with. She's Eileen Kopsoftis. Manual PT. She is at havelifelongwellbeing.com. So before I start today too, I just want to remind you that tomorrow, Saturday at 10 a.m., I'm doing a free teleconference call. You can either join me via telephone or online. And I'm going to talk about informed healthcare decision making. So if figuring out how to learn about health information and health situations and issues and how to make good decisions is something you want to find out about, join me tomorrow morning. It's free. You can stay in your PJs, grab your coffee, and dial in. Just message me and I'll get you hooked up before the call. I'd love to have you. I also want to shoot you a little reminder about the Women's Back to Nature weekend I am hosting with my friend Sue Hardesty. She's another health and wellness coach, and we are hosting a Women's Back to Nature weekend the weekend of June 8th to 10th at Camp Tuscazor here in Tuscarawas County, Ohio, Dover, Ohio. So go to Facebook at Back to Nature, and you can find our page and you can register and check it out. So there's an early bird discount till March 31st. So on to pain. So we talked a couple weeks ago about pain and how images like x-rays and MRIs don't always match up with what is actually causing the pain. We can have abnormal findings, and we may or may not have pain. They do not go hand in hand all the time. So images are not always a good they're not always a reliable indicator of what is actually going on, what's wrong, and what's causing our pain. And last week we talked about pain medications and surgeries, and how that, how they stack up in helping our pain. So if the pain medications that we talked about last week aren't, we talked about how ineffective they can be. So what do you do? Well, usually if medications don't work, medications and time don't work, then surgery is suggested or considered. And surgery doesn't always fare much better either. Usually if someone sees a herniated discs on imaging, this is one example, it's kind of assumed that surgery is automatically necessary. Well, herniated discs actually can heal on their own. It just does take some time. It can take up to a year, but they can heal. So you're not doomed to spinal fusion, which is often what is suggested. And some studies done show that those who had surgery fared no better than those who did not. So you want to do something that's going to fix you. And if the problem is pain, you want the surgery to fix what's causing the pain, right? Remember the two questions you always want to ask whatever you're considering. How will this affect what's causing my problem? And what are the risks? How will this fix me? Will this fix me? And what are the risks? Knee surgery. If meniscal tears, you got to have it operated on. Well, those who have had just physical therapy for meniscal tears fared just the same as those who had physical therapy and surgery. So results were the same. And it's estimated that there are 700,000 unnecessary knee surgeries per year. That's a lot of money, time, and effort for something that's not successful. And the problem is that surgery doesn't address the core issue of why you hurt, and that is inflammation. And what happens is when something unusual is found on imaging, we automatically say, well, that's what's causing the pain, if you have pain and an abnormal finding. So we really need to take a much more multifactorial approach to pain. You need to consider nutrition, lifestyle, of course, medications. A lot of the medications used to treat pain cause something called hyperalgesia, and that causes increased sensation of pain. Our pain patterns, our thought patterns, so many things affect our state of health and our state of well-being. Most in regards to nutrition, lumbar artery disease is considered the major cause of back pain. Okay, so it's not compression, it's not wear and tear, it's arterial disease. The muscles aren't getting enough oxygen. Sitting, looking at lifestyle, sitting is the fourth leading cause of death. So hyperalgesia that I mentioned, that is when nerve cells respond abnormally to normal stimuli. And this is, as I said, this is Eileen shared in a talk she gave at our conference this fall, that this can often happen as a result of pain medication. But these nerve cells can be, these nerve cells can be retrained. You can recover from this. Different habits and thought processes can stimulate pain perception. Okay, so cognitive behavioral therapy can sometimes be very helpful in addressing pain. Neurofascial inefficiencies and rehydrating and lengthening our fascia and connective tissue, and that can be done through something called MELT method, which is a self-treatment therapy that you can learn. Biomechanics obviously can need to be addressed sometimes. So there are many different modalities that can be addressed with manual physical therapy. And manual physical therapy differs from conventional physical therapy a bit in that the whole, first the focus is on patient education, teaching self-treatment and self-care after, kind of taking care of the patient, helping them, and then kind of setting them up to take care of themselves a lot. You want to look at whole body mechanics, symmetry, and function. Look at alignment needs to be considered. And manual PT restores postural efficiency and muscle symmetry and effective functional movement patterns. Now, doesn't that all sound symmetry, functional movement, alignment? Doesn't that all sound like common sense, like things we want to be able to do with our body? So it's a great approach to therapy, and you can look for manual physical therapists. If you do, there are things you want to make sure they address all those kinds of issues. And finding the right kind of healthcare providers and knowing what questions to ask when you are interviewing and considering a healthcare provider. And yes, you should interview your healthcare providers, be they physical therapists, doctors, physical trainers, acupuncturists, herbalists, whatever they may be. And some of the techniques you want to make sure, if you're looking for a manual PT, you want to see if they are trained in muscle energy techniques, strain, counter strain, mobility with movement, chain reaction, so some other different things. Those are just a few. And again, learning how to interview those kind of providers and find out what they need to know to help you, or that's what we help you do at Wellness Forum Health. So if you want to kind of learn more about how to get started on that road, join me tomorrow morning, or follow me on my Facebook page, Eat, Learn, Live, and I will see you next week. Thank you.